So there are 34 active cases of coronavirus in Victoria. A remarkable 40,411 people got tested yesterday, the most ever processed. So my thanks to everyone. I know there was a level of inconvenience with those magnificent numbers, but I do thank everyone for getting tested. And we had 12,677 people getting vaccinated, another extraordinary number, and my thanks to everyone who are hearing the call. The best thing we can do is to get vaccinated when we're eligible. We said this time yesterday that the next 24 hours were going to be particularly critical in terms of what our next steps will be to ensure that we keep our state safe. In the last day, we've seen 12 linked new cases, bringing the total number of cases linked to the hotel quarantine breach in South Australia to 26. Sadly, we have one of those people in an ICU on a ventilator in not a very good way. In the last day, we've seen more evidence that we're dealing with a highly infectious strain of the virus, a variant of concern which is running faster than we have ever recorded. As of first thing this morning, we've identified in excess of 12, from first thing this morning, we've identified in excess of 10,000 primary and secondary contacts who will need to either quarantine or test and isolate, and that number will continue to grow and change. Our public health experts' primary concern is just how fast this variant is moving. And we've seen overseas how difficult that movement can be to control. Here in Victoria, we're seeing not only how quick it is, but how contagious it is as well. Our contact tracers are identifying and locking down the first ring, second ring and third ring within 24 hours. They've never done that before. That is the fastest our contact tracers have ever moved, within a 24-hour period, identifying and locking down first, second and third rings of cases. But despite working as fast as this, and my thanks to all of our contact tracers, this variant is moving faster still. The time between catching the virus and passing it on is tighter than ever. So for some of those cases that I've mentioned, for some of them, the serial interval, that is how long it takes between the onset of symptoms in the first and secondary case, is averaging just over a day. Now, to put that in some perspective, the usual transmission is about 5 to 6 days. In some of these cases, within a day, it's being transmitted. And in just 24 hours, the number of cases has doubled. So unless something drastic happens, this will become increasingly uncontrollable. We also know our nation's vaccine rollout has been slower than we hoped. That is a fact. The vaccine rollout is not where we hoped it would be. It's not where it should be. And if more people were vaccinated, we might be facing a very different set of circumstances than we are today, but sadly, we are not. If we make the wrong choice now, if we wait too long, this thing will get away from us.